Everyone, I hope everyone is having a great Saturday. So, a little birdie, I actually found out through TikTok that yesterday was actually chronic illness, chronic disease awareness day. So, I made a whole script for it so I could be able to talk to you guys about it. So, here we go. Imagine spending your entire life feeling like your body is trying to tell you something, but nobody listens until you're the only one who has to fight for answers. Yesterday was Chronic Disease Awareness Day. But for millions, chronic illness awareness isn't something that happens one day a year. It is every morning you wake up in pain. It's every appointment where you have to explain your symptoms again. It's every time you wonder, why does my body feel this way? And it's every moment when you have to decide whether to keep pushing for answers or accept another dead end. This is my story. My medical journey started when I was only 3 weeks old, believe it or not. I have the scar to prove it right here. I was born in 1994 and I developed pyloric stenosis, a condition where the muscle between the stomach and small intestine thickens and prevents food from passing through, and water too. I was dehydrating and starving to death. At the time, pyloric stenosis was much more commonly recognized in male infants. My mom was fighting for doctors to understand that her baby girl was seriously sick. She had to fight for me to receive the life-saving surgery I needed. And because my mom refused to give up on me, I am here today. That was the first time someone had to fight for me to be heard. Unfortunately, it would not be the last. Fast forward to adulthood. My body continued giving me signs that something was wrong. I've spent years dealing with symptoms that have affected every part of my life. Chronic pain, extreme exhaustion, joint issues, skin symptoms, episodes of feeling unwell, and eventually in July of 2022, I became completely physically disabled. My life changed. Things that many people do without thinking became difficult. Simple daily tasks became battles. And when you live with chronic illness, you learn that the hardest part isn't always just the symptoms. Sometimes the hardest part is proving that those symptoms are real. Over several years, I had multiple positive over the last, since I became completely physically disabled in 2022. I had multiple positive ANA tests and additional abnormal blood work that led me to seek answers about possible autoimmune diseases. I was referred to rheumatology hoping for answers. Instead, I left feeling dismissed because my ANA levels were considered only mildly positive. I saw the doctor for all of 5 minutes, and in those 5 minutes, he decided that I didn't need to be tested for anything. Without even actually getting to know me, getting to know my symptoms or anything, he just said, "You don't have anything. You're fine. Go back to your hematologist." But here's something many people don't understand. A test result is only one piece of a much larger puzzle. A person's symptoms, medical history, physical examination, and additional testing all matter. The conditions I am currently investigating include autoimmune and connective tissue disorders, specifically lupus and hypermobile Ehlers-Danlos syndrome. I'm not looking for a label, I'm looking for an explanation, because an explanation can mean better treatment, better management, better quality of life. Another major moment in my healthcare journey happened in October of last year. I went to the hospital because I knew something was wrong. I went to Piedmont Hospital in Augusta, Georgia. At that time, I felt like my symptoms were being minimized. They absolutely were. I actually went to a doctor after I went to Piedmont Hospital here in Augusta, Georgia, and they told me that I had a stress-induced heart attack at 31 years old. And Piedmont Hospital decided to diagnose me as it just being gas. Interesting. Later, another healthcare professional diagnosed me with a stress-induced heart attack. That experience changed me. It made me realize even more how important it is to advocate for yourself and listen to your own body. And sadly, my experience is not unique. Millions of people with chronic illnesses know what it feels like to search for answers. Here are some facts. About 6 in 10 adults in the United States live with at least one chronic disease. About 4 in 10 adults live with 2 or more chronic conditions. Chronic diseases are responsible for the majority of deaths and healthcare costs in the United States. Around 80% of people living with autoimmune diseases are women. Many autoimmune diseases take years to diagnose because symptoms can overlap with other conditions. And doctors like to look at women and go, it's just anxiety. Oh, well. Women have historically been underrepresented in medical research, which has contributed to gaps in understanding how certain diseases present in women. Take, for example, them researching endometriosis, but not in the way of how to help women with the pain and how to diagnose properly, but instead how it affects men's mental health, how having a partner who has endometriosis affects their mental health. And I'm not saying men's mental health isn't important. It absolutely is. But when you're speaking louder about the men's side of it instead of who it's actually affecting and causing issues with and causing harm to, which is women, that becomes a problem. Many autoimmune diseases take years to diagnose because symptoms can overlap with other conditions. Women have historically been underrepresented in medical research, which has contributed to gaps in understanding how certain diseases present in women. And one phrase many women hear over and over again is, it's just anxiety. Now, anxiety is real and deserves treatment when someone has it. I have diagnosed generalized anxiety, as well as panic disorder. But anxiety should never automatically be used as an explanation without properly investigating physical symptoms. People deserve to have their concerns taken seriously, women and men alike. This is why once my financial situation becomes stable, I plan to invest in whole genome sequencing through sequencing.com. Now, I'm not advertising for anything. This is just something I found that tests for it's one of the tests that tests for the most genetic autoimmune issues that you could possibly have. And at this point, I'm in a position where I need to get the answers and then present it to a doctor next time I go. So that way they can't argue with me, they can't dismiss me, and they can actually treat the problem instead of putting a Band-Aid on the symptoms. People deserve to have their concerns taken seriously. Not because I believe genetic testing replaces doctors, not because I think one test will magically solve everything, but because after years of searching, I want more information. And Ehlers-Danlos, hypermobile Ehlers-Danlos syndrome and lupus are the two things that match me the most as far as all of my symptoms go. I've done a lot of research. I want another tool. I want data I can bring to my healthcare providers. Whole genome sequencing may help identify certain genetic conditions, rare disorders, or connective tissue disorders. And while hypermobile Ehlers-Danlos syndrome currently does not have one confirmed genetic test, genetic testing can still help investigate other possible inherited conditions that may explain my symptoms. This isn't about chasing diagnoses. This is about advocating for my health. This is about trying to understand why my body has been struggling. This is about finally addressing the root causes instead of only putting temporary solutions on symptoms. To everyone living with chronic illness, I see you. To everyone still searching for answers, keep advocating. To everyone who has been told you don't look sick, remember that invisible illnesses are still real. Your pain matters, your story matters, and your life has value. Psalm 139 verse 14 says, I praise you because I am fearfully and wonderfully made. Even on the days my body fails me, I know God has not forgotten me. My story is not over, and neither is yours. I hope you all have a blessed weekend. I hope you guys realize that this is a much bigger issue than what the surface tells us, that everybody should research their symptoms. You are your own best advocate, especially in the medical system we have here in the USA. You all have a blessed day, and I'll talk to you later. Bye.